You are watching McLaren Port Huron's Today's Health program. Today we're talking again with Dr. Joseph Cuppari about peripheral arterial disease. Welcome back.
Thanks.
So can you talk a little bit about the risk factors?
Yes. So risk factors for peripheral arterial disease, PAD, I break it down into two parts. So you have the modifiable risk factors and the non-modifiable risk factors. So non-modifiable are the ones that you can't control. Okay, so male, gender, age, your genetic predisposition for the certain disease. These are things that you have no control over, so don't worry about those.
Right.
The modifiable ones are the ones that we definitely need to control, and those are smoking, diabetes, high blood pressure, high cholesterol, and then coronary artery disease I throw in there, but that's basically the same thing as peripheral arterial disease.
Okay, so some things you can control and some things that you
Correct.
can't. Okay, what about signs and symptoms?
So in general, PAD, I'm going to focus down on the lower extremities on this question. The signs and symptoms, so the symptoms are going to be pain. Okay. Usually what the classic example is someone that says, I get pain with exercise, cramping type of pain, that at a certain distance comes about, and then when I stop exercising, it goes away.
Okay.
Okay, so this is reproducible. Most people will say, I walk 100 feet, I get pain, I stop, goes away, I walk another 100 feet,
Comes
pain.
back. Okay.
So some of the signs, though, can be a cool extremity, discoloration, so purple or bluish discoloration, all of which signify decreased blood flow.
Okay.
Loss of hair in your legs and toes. And then depending on how severe the peripheral arterial disease is, then you can start getting into non-healing wounds and things of that nature.
How is peripheral arterial disease diagnosed?
By a history and physical exam.
Okay.
For the most part. So a good physician, just by your story, like I said, the pain is pretty classic. So if you get that history, then you have a high suspicion that they have peripheral arterial disease. Once you get that high suspicion you do a physical exam, check for pulses. They can have diminished pulses in their extremities and their feet. Also, as I said, coolness, the numbness, tingling, things of that nature. Once you have that suspicion, then you can do tests.
Okay.
So different tests that we like to do in the office are ultrasound based. So we have a Doppler study, which basically looks at the vessels with ultrasound, looks at the lumen to see if there's anything inside of it that's causing that plaque buildup that we were talking about, and then also the flow that goes through it. Another modality that we can use is what's called segmental limb pressures, and we can calculate an arterial brachial index, or an ankle brachial index, sorry. And this will give us the severity and sometimes can give us where in the legs you're having the discomfort or the pain. Also, we can get CTs or CAT scans. MRIs or MRIs that also can look at the vessels, and then the gold standard for diagnosis, or once you've diagnosed that you have it, is an angiogram.
Okay. So if you're the kind of person, like you said, that's having a lot of leg pain, and you don't get a diagnosis and it goes untreated, what kind of complications can arise from that?
So we're going to focus on the legs. So yeah, if you have pain in the legs and you don't get it treated or you don't get it diagnosed and it progresses, it can progress to tissue loss. So like we've been talking about, is peripheral arterial disease is the decrease of blood flow and oxygen. So if you decrease that oxygen to the tissues, the skin, the muscle, what can happen is that can die. Anything that doesn't have oxygen, us in general, if we don't get oxygen, we don't get nutrients, then we die. So same goes for the tissues. Then you can get gangrene, you can get wounds that don't want to heal, things of that nature. Also, like I said, that it's a systemic disease. Heart attacks as well as strokes can also be a complication.
Okay. Can it be prevented?
This is a good question. It's an interesting question. The severity of it, yes, can be prevented. As we were talking about, the risk factors is age. You can't really stop the aging process. You know, and as I said, genetics. So I think majority of people, or a lot of people that we don't realize, have peripheral arterial disease. So the object is not to completely eradicate the disease, it's to have the disease but not have complications of it. So to answer that question, yes, we can prevent complications, and by doing that we have to prevent or change the modifiable risk factors.
Okay. All right, we're going to take another break, and then when we come back, we will continue our discussion.
All right.